As the second COVID wave has left Indian health system in dire straits, the common citizens have stepped up and joined the authorities in fight. From quarantine centers to ICU facilities, different communities are coming up with all forms of assistance to strengthen the fight. Meanwhile, in Pakistan and Himalayan nation Nepal too, the second wave is gaining pace. Nepal's positivity rate has gone as high as 44%. Pakistan has rung alarm bells after strains first detected in Brazil and South Africa were found in fresh infections.
Indians have joined the fight against COVID as a dire second wave of infections has left hospitals and facilities overflowing. Makeshift arrangements by communities are turning out to be a blessing for patients who have no place to go in the country's overwhelmed health system due to a massive surge of hundreds of thousands of infections every day. A Sikh temple in the Indian capital, New Delhi, was converted into a COVID-19 care facility with oxygen supplies.
ये 250 बेड का हमने इसको तैयार किया है। इसके अंदर हर तरह की मेडिकल फैसिलिटीज़ हैं, लेकिन आईसीयू नहीं है। और इसके अंदर ऑक्सीजन बेड्स हैं, सारे के सारे डॉक्टर हैं, नर्सेस हैं, दवाइयाँ हैं।
Daily infections rose twice by over 400,000 infections, Health Ministry data showed. The number has been in excess of 300,000 every day for the past 2 weeks. The governments have been working overtime to contain the spread, but the experts say the unprecedented surge will take a few weeks more before showing some signs of decline. The state government of Uttar Pradesh constructed a COVID-19 hospital that can accommodate 750 patients at its prestigious Banaras Hindu University campus. Authorities in northern Srinagar city were preparing to open an isolation facility with 250 beds, which includes an ICU ward.
In this hospital, we have an intensive care unit. We have 2 small high dependence wards where we can give oxygen, and then we have 10 wards for those patients who don't need ICU or who don't need oxygen. The facilities are, we have about 20 functional ventilators. Then we have cardiac monitors. Then we have defibrillators. Then we have pulse oximeters. Then we have oxygen concentrators.
In northeastern Guwahati city, authorities converted Indian Railways train coaches into isolation facility to accommodate the patients who are unable to find space in the overwhelmed hospitals. While India has enhanced its medical production by several times in past 3 to 4 weeks, it has also been receiving aid from far and wide. Oxygen's demand has raised record times in last few weeks, with demand likely to be stabilized in few days, the government and private players have assured the country. Meanwhile, India's neighbor Nepal too is being overwhelmed by a COVID-19 surge. Nepal is now recording 57 times as many cases as a month ago, with positivity rate reaching bordering 44%. Nepalese towns near the Indian border could not cope with the growing number of people needing treatment, while only 1% of country's population was fully vaccinated. The new wave has seen a shortage of hospital beds and medical supplies across the Himalayan nation.
हाम्रो इमर्जेन्सी 5 बेडको इमर्जेन्सी थियो। अहिले हामीले यसलाई 25 बेडसम्म बनाएका छौँ। 20 वटा बेड हामीले इमर्जेन्सीमा मात्र थपेका छौँ र आजका दिनसम्म हामीले कसैलाई पनि अक्सिजन नपाएर फिर्ता चाहिँ हामीले गरेका छैनौँ र यो अब अवस्था निकै जटिल बन्दै गइरहेको छ। यद्यपि हाम्रो साथीहरू निकै खटिरहनु भएको छ, चाहिँ 24 घण्टा ड्युटी गर्नुभएको छ। अहिले तपाईँहरू जुन देखिरहनु भएको छ, हामी अहिले पनि कुर्सीमा राखेर पनि अक्सिजन लगाइरहेछौँ। हाम्रो एउटा चाहिँ सबैभन्दा चाहिँ राम्रो हामीले गर्न सकेको भनेको चाहिँ अक्सिजन नपाएर कसैलाई फिर्ता गरेका छौँ।
Meanwhile, Pakistan has detected 2 coronavirus variants first identified in Brazil and South Africa. The highly contagious variants were discovered at a hospital in Karachi, Pakistan's largest city, which has also reported the most deaths in any city, accounting for 3,903 of the country's 17,811 deaths.
कल जो है 13 जो है सैंपल्स की जीनोमिक स्टडी हुई है, ये आगा खान यूनिवर्सिटी हॉस्पिटल में हुई है। इसमें 10 जो है यूके वेरिएंट आए हैं और 2 अफ्रीका और ब्राज़ीलियन वेरिएंट आए हैं। तो आप समझ सकते हैं कि ये नौयत किस किस्म की नौयत और किस किस्म की दबाव पड़ सकता है हेल्थ की फैसिलिटीज़ पे, हमारे हॉस्पिटल्स पे।
Pakistan has seen record deaths in recent days from the coronavirus, and stricter restrictions on movement and gathering in public are planned for the upcoming Eid holiday. Officials are worried the country's healthcare system, already under strain, could reach breaking point if more contagious variants of the virus begin to spread.